Hi there, everybody. Thank you for joining. Sorry for the technical problem so far. We're just getting set up and should be able to start in a couple of minutes.
Can you see me?
I can hear you, Helen. Loud and clear.
You can't see me though.
Not yet.
Oh, there we are.
IT is not our friend today, is it?
Is that working?
I can see you, Helen. I've got your slides hopefully up on screen. Can you see them okay?
Yeah, brilliant.
Hopefully. I think people are just starting to filter in with the new joining code, so I'll give people a couple of minutes.
Okay.
Thanks everybody for joining. I can see a few people are starting to filter in. If you just give us a couple of minutes, because I appreciate some people might have got the email a little bit late with the new joining code. Lovely background, Helen.
No, thank you. It is quite colourful and actually matches my presentation slides, which we didn't aim for at all.
Okay, I appreciate colleagues are starting to come into the room. So welcome everybody. Thank you for bearing with. Our apologies with the IT faults we've had today. I'm really excited to see you all at our second webinar with 19 Hills CIC Place-Based Community Development, Health and Wellbeing Social Enterprise that is active in the east of Newport, South Wales. Today, we're really excited to have with us Helen Britton, who's had a recent new exciting new job, which I'm sure you can tell us about in a second. And the focus for today was about place-based approaches in health around how do we build stronger partnerships, stronger collaboration, stronger links and engagement with local residents and communities, and what the evidence is for that. The structure will be Helen's very kindly giving us a presentation based on some research that she's done herself. Appreciate at the moment just to kind of keep things to time, recognizing this might be happening in people's particularly coal-face facing jobs. In the lunch break, we've just tried to keep it with a simple webinar with a couple of speakers, and then there'll be time for questions and answers. So we should be starting shortly. Presentation for about 15-20 minutes, bringing us up to around about 20 past 12, leaving plenty of time for questions and answers. So do feel free, now I remember it, to pop any questions or thoughts or reflections in the chat box that hopefully I'll double check in a second, should be active. You're very welcome to introduce yourself, to say who you are, why you've joined this, what you're interested in, ideas for future webinars too. Sorry, Helen. And just to let you know, this is being recorded. If you want to share the recording afterwards, it will be going out on LinkedIn. It's on our YouTube page, and I believe through Eventbrite and our newsletter, you can sign up to find out where other events and webinars might be taking place. I'll shut up because this isn't about me. I'm very excited to hand over to Helen to introduce yourself and talk us through the presentation. Helen, I'll mute myself, but I'm happy to change the slides for you if that works.
Brilliant. Thank you for the introduction, Johnny, and thank you for the opportunity to present. So yes, my name is Helen Britton. I'm the head of planning at the Welsh Ambulance Service University Trust, and a postgraduate researcher at Cardiff University. So as Johnny said, I'll be sharing my insights with you today from my MSc dissertation, which explored place-based approaches in healthcare through a realist evaluation lens. So this work is grounded in the Welsh context, but it offers lessons that are widely transferable. So I'll start by sharing the context. So why place-based approaches matter now more than ever, and then I'll outline the study's aims, the research approach, We'll explore the key findings, the enablers and the barriers. I'll touch on some critical success factors for refining, scaling and sustaining change. I'll briefly reflect on some limitations of the study, and then I'll end with some recommendations for policy and practice. So I hope this presentation sparks some discussion and inspires some fresh thinking in your work. So if we move on then to the next slide. So in Wales, health inequalities remain a persistent challenge. And as Williams et al. Describe it, they are avoidable, unfair and systematic differences in health between groups of people. So I think this really captures the urgency. Sadly though, despite our progressive policy frameworks here in Wales, there are still gaps that still persist. However, we do have strong foundations. So we have the Wellbeing of Future Generations Act, we have a Healthier Wales that both called for a more joined up, preventative and person-centered care approach, and they encourage us to move away from the hospital-centric systems and more towards a community-based model that actually reflect people's real lives. So place-based approaches align perfectly with this vision, because what they do is they offer us a way to design our services that respond to the local needs. They build on our community strengths, and they also tackle inequalities from the ground up. So if we move to the next slide then. Place-based approaches, they come in so many different forms. So I've just picked out two of the definitions here. So McGowan et al. Has said that it's any intervention that aims to improve health and reduce health inequalities and is delivered at a local or regional level. Taylor and Buckley describe them as collaborative partnerships aimed at achieving significant change. So they're not a one-size-fits-all solution, but what they are is they're dynamic, they're adaptive approaches that evolve with the communities that we've served. Despite the many definitions that there are out there, what unites them all is the focus on the local context. And these definitions highlight they're actually not just about service delivery, but really they're actually about transformation as well. So if we move to the next slide then, place-based approaches are really, really powerful for tackling complex challenges or wicked problems as they're referred to. So these are problems like poverty, chronic illness, social isolation, issues that don't have simple solutions, and they're often worsened by fragmented systems. So in the climate that we find ourselves in now, which is rising demand, limited resources, place-based approaches can offer a better way forward. So they can join up all our efforts across health, education, housing, social care, and they can reduce that duplication and actually address unmet needs more effectively. But place-based approaches aren't just about systems, they're also about people as well. So they improve the equity by tailoring those solutions to the local realities of our community, and empower our community to through genuine engagement. So in my research, participants consistently stress the value of community assets. So by that I mean things like local knowledge, social networks and lived experiences, as these being absolutely critical to designing services that actually work. So the next slide is all about the gap in the evidence that I found. So despite the growing policy support that we have, the evidence base for place-based approaches remains quite limited. As you'll have seen, there's a variety of models, there's no standard definition, and there's significant variation in how place-based approaches are implemented. And what I found was that most of the existing research focuses on outcomes, so what happened, but rarely did it explore, well, what are the mechanisms, what is the context, and that explain why it happened, for who it happened, and under what conditions. And this gap makes it really, really difficult to replicate that success or adapt models to new settings. And it also leaves policymakers and practitioners without the insights that we need to be able to design more effective and locally responsive interventions. So that's why I chose this area to study for my dissertation, to move beyond that surface level evaluation, but to develop a deeper, more theory-informed understanding of place-based approaches and how they actually work in practice. So the next slide then, I wanted to explore this through my study. So I'll outline some of the aims that I had, and simply I wanted to understand how, why, and under what conditions do place-based approaches actually work in practice. So more specifically, I looked to identify those key contextual factors influencing the adoption. I wanted to analyse the mechanisms that either enable or constrain implementation. I wanted to understand and examine the barriers to achieving outcomes and evaluate the outcomes themselves. I looked to define the core components of sustainable and transferable models. And then finally, I wanted to develop evidence-informed recommendations for scaling and for the adaptation. So the next slide then, without getting too technical, my study is based on a way of thinking called critical realism. So in very simple terms, this approach recognizes that the world is really complex and the outcomes that are shaped by many hidden factors, not always ones we can easily see or easily measure, which actually makes it a really good fit for studying something as layered and as complex and as context dependent as place-based approaches. So to explore this, I used realist evaluation, so a method that doesn't just ask, did it work, but actually, how does it work? Why, for whom, and under what circumstances does an intervention actually work? And I combined a review of the literature with qualitative in-depth interviews using a very focused approach that, for me, prioritized the depth over the breadth, so I could really understand what was happening on the ground. So the next slide, yes, I appreciate this slide is quite detailed, and I won't go through it for every element, but I wanted to just show you here the structure behind the study. So in essence, the research followed, oh, we've lost the slide. The research followed a two-phased evaluation. So phase one, there we go. Phase one involved building an initial program theory through which I did a rapid literature review. So essentially, this was me mapping out how place-based approaches are expected to work and under what conditions. Phase two then tested and refined this theory, which was then informed by the interviews that I'd had with 10 stakeholders across Wales and England, including clinical leaders, program directors, people who'd been involved at the implementation of place-based approaches. And their insights were invaluable in grounding that theory in real world practice and added a lot of depth to the findings. So let's move on now to the key enablers. So these are the conditions that help place-based approaches really deliver the impact. And as we're limited on time today, I'll just share these at a very, very high level, and I'll just share a few that I've written about. So the first one, policy alignment. So when national, regional, and local frameworks are aligned, local teams felt really empowered to act. And what participants stressed to me was that the long-term consistency mattered more than the rhetoric. And without that clear national vision, momentum often stalled and delivery was fragmented. So leadership and vision. So inclusive, values-driven leadership was essential for building that trust and navigating the complexity. Psychological safety and distributed leadership empowered our frontline teams. And whilst clinical leadership was present, it also added that credibility. However, it needed to be balanced with the community voices and clearer governance to avoid any blurring of roles. Stable multi-year funding enabled that strategic planning and innovation, and in contrast, short-term and fragmented funding, as you would expect, it disrupted that continuity and it put a lot of strain on relationships. So what participants called for was an accessible funding process that was easy and accessible, and one that also had that shared financial responsibility to support the long-term relational nature of place-based approaches. So effective place-based approaches also relied on really strong systems of cross-sector collaboration and clear governance, shared resources, and having that aligned accountability between the organisations really helped create a join up of services. So integration across health, housing, public health, and the third sector was absolutely critical, but especially when the partners were all treated as equal. So if we move on to the next slide, community involvement. Yes, so community involvement was absolutely critical to shaping relevant services. Participants emphasised that communities, they need to be equal partners, so not just passive recipients. So participants recognised that meaningful engagement with communities led to them asking more relevant questions, created stronger relationships, and ultimately improved outcomes. And research does show us that genuine community engagement enhances trust and overall effectiveness of services. Now, timely, local, granular data, especially when it's enriched by lived experience, enabled a shift from reactive to preventative care. And participants really valued combining metrics with insights, and they called for a broader definition of well-being, including social and emotional dimensions. So co-produced measures like healthy days at home were also seen as really quite meaningful. But what was evident in this approach to me was that there was an appetite from many of those that I spoke to move away from the narrowly medicalized model and actually more towards holistic systems that are more aligned with the full spectrum of our individual and community needs. And finally then, cultural readiness. So yes, so technical enablers alone weren't enough. What we need is that shared mindset, which is grounded in, all the good stuff: collaboration, trust, relational governance. That's absolutely essential. So, and whilst the aspiration is to move care more upstream, that was widely supported. What I found was that it was often underfunded. It was constrained by legacy systems. And it just, whilst the appetite was there, the supporting enabling instructions behind it weren't. And we know that real change requires not only new models, but actually new ways of thinking as well. So if we move along to the barriers then. So alongside these enablers, the study surfaced a number of barriers that continue to limit the impact of place-based approaches. And I'm sure many of these won't come as a surprise to you. So the first one, as I've mentioned already, was fragmented funding. So it's really difficult to plan, to build trust, and to sustain innovation with fragmented funding and short-term funding cycles. It forced the people I spoke to make reactive decisions, which actually undermined and goes against the whole preventative ambition of place-based approaches. Frequent leadership changes, they disrupted continuity and weakened the shared vision that the organisations had, and this instability often stalled progress in some cases, which was sad. So community involvement. So whilst community involvement was widely valued, what I found and what I was hearing was that it was actually limited to just consultation and without any real influence, which actually reinforced that existing power imbalance and at times could have been considered a little bit tokenistic. And then lastly, despite really strong aspirations, current frameworks did prioritise short-term outputs over those long-term relational outcomes. And participants cited barriers for this being digital infrastructure, fragmented digital infrastructure, inconsistent metrics, restrictive governance frameworks, and examples actually that participants share do reflect what Moore et al. Had described as a measurement paradox. So where we have the high value but really intangible outcomes like trust, morale, social capital, they're really hard to monitor, to demonstrate. These largely remain invisible. So these barriers highlighted a core tension for me. So whilst the rhetoric around transformation is really strong, this is what we talk about, this is what we read about, the systems and the structures often underneath it, underpinning it all, were very misaligned. So addressing these challenges is absolutely essential if we are serious about embedding place-based approaches into mainstream practice going forward. So outcomes. So in enabling contexts, the place-based approaches are showing really, really early signs of impact across services, relationships, and system level thinking. Whilst the longer term outcomes were difficult to evidence, given that the stages of most of the initiatives that I heard about were at the early stages. And we know that it takes a lot of time for transformation. But what participants did describe to me was that actually the short and the medium term changes laid the foundations for more longer term success. So if we look at the short term then, what I found was participants, they noted that the service was more responsive and had stronger community relationships. The staff felt safer to collaborate, and community engagement shifted from more of consultation to influence. And that in some cases resulted in fewer ED emissions and successful, for one participant I spoke to, successful community-led funding. Medium term, so the effective integrated working enabled earlier intervention and eased pressure on the emergency services, and the relational care improved patient outcomes. So whilst flexible governance supported local innovation, in some cases there were really great measurable health outcomes. The long term then, so as I've said, they were still emerging because systemic change takes time, but there was evidence of shifts in the planning language and that cross-sector dialogue, and that suggests that deeper transformation is to come. But the success was reframed to include trust, collaboration, and learning, which was really positive. And this for me all pointed in the direction of actually more relational, locally accountable care. But as we know, the key challenge for us all that lies ahead in aligning it's going to be aligning those structural conditions, the funding, the governance, the data, and the accountability to move forward. So next slide talks about critical success factors. So whilst the early outcomes highlighted the potential of place-based approaches, participants were very, very clear that place-based approaches need active support to be sustained, and embedding place-based approaches into long-term system-wide change, it depends on a number of interdependencies or interdependent success factors. So I think these are best understood for me, not as optional extras, but actually essential building blocks for the learning, the legitimacy, and the longevity going forward. So the first one here is visible impact and credibility. So even those small improvements in people's lives were absolutely vital for maintaining that energy, that trust, and securing that political support that's needed. And demonstrating that impact wasn't just seen as a strategic tool. It was seen as a strategic tool to build that belief and maintain momentum, not just as a reporting mechanism. The second one is clear value proposition. So yes, articulating both the social and the financial value really helped align place-based approaches with the system priorities. So showing that reduced demand, showing the cost avoidance and the improved well-being made that case for continued investment in many cases. And lastly, adaptation and agility. So place-based approaches were seen as dynamic, not fixed in any way, and success relied on the ability to be able to iterate, to adapt, and to the emerging needs and remain flexible. And as one participant put it to me, your work is never done. It's never done. You need to constantly reevaluate and adapt, which I thought was really useful. So limitations. So of course the study had limitations. The sample size was very small. It was a sample of 10, and it focused on professionals rather than service users. The cross-sectional design offered a snapshot in time, so it wasn't a longitudinal view. And the differentiating between context, mechanisms, and outcomes is inherently interpretive on my part and also iterative. But I think future research going forward should aim to address these limitations through longitudinal, multi-perspective designs that explore place-based approaches and how they evolve over time and across those diverse contexts. But that said, I feel that the study contributes meaningfully to both theory and practice, and it offers a refined program theory that can support real world implementation and certainly inform future place-based work. So if I end on some recommendations then, so based on the findings, I offered 7 recommendations for policymakers, system leaders, practitioners seeking to design, implement, or scale their place-based approaches effectively. The first one is investing in enabling infrastructure, so really to support that collaboration and that adaptive leadership. So by this, I mean including funding for those relational roles, and the putting in place those governance structures that will facilitate that shared decision making and knowledge exchange between organizations. Second one is trickier, but securing that long-term flexible funding and assuring that it is aligned with preventative goals. The third one, foster inclusive leadership. So inclusive and distributed leadership across all levels. So include the voices from your communities, the voluntary sector, the frontline staff. That's really important. But also leadership development should focus on building that capacity of adaptive, cross-boundary working, and also psychological safety, which we know is important. Refining success metrics. So this really needs to include those relational, community-centered outcomes. So moving beyond that narrow-minded or narrow performance metrics to capture actually what matters to communities, such as trust, empowerment, well-being, and embed this through continuous learning, through reflective practice, feedback loops, and developmental evaluation. Deepening stakeholder engagement. Yes, so through meaningful co-production. So ensure that our service users, our community members, frontline practitioners are actually meaningfully involved, not only in the implementation, but the design of it, the delivery of it, and the evaluation of place-based approaches. And consider thinking co-production, embedding it as a principle, a core principle, not as an afterthought. Using data strategically. Yes, the data should not only be used for accountability, but also to inform learning, inform that equity, and inform responsiveness. So, and combine quantitative indicators with qualitative insights and lived experience. And then lastly, I've spoken about this already, but to really support that ongoing research and evaluation to be able to inform scaling and sustainability going forward. So to conclude then, hopefully what I've demonstrated through my research findings is that place-based approaches are not fixed models, they're adaptive, relational processes, and their success really does depend on trust, shared purpose, and relational processes. So my refined program theory developed through this study highlighted the success of place-based approaches is not about replicating standardized frameworks. Instead, it depends on creating those enabling conditions. So that sustained and equitable funding, psychological safety, the strategic use of data, and these mechanisms, when they're activated in those supportive contexts, that's where it can really foster innovation and long-term change. Thank you very much.
Thank you, Helen. That was absolutely fantastic. Thank you for running to time too. So colleagues, there's a chance for questions. The way to pose a question, there's been a couple so far, including checking some tech issues, is to go into the Q&A box. I believe it's probably under the more 3 dots in the top right. But if you have a little browse, see if you can find that. And we'll try and get some questions coming in, which I know seemed to work fairly well on our last webinar. Whilst people are just trying to grapple with that, Helen, you may be seeking to publish this. So I guess the first thing was, would you be happy to kind of share anything in kind of writing really in terms of the publication and the report? That would be fantastic if we could get that out to attendees. And yeah. I suppose thereafter, I'll take the sharing off really so we can end there. I believe you've got a new exciting role with the Welsh Ambulance Trust, which is really fantastic. Congratulations on that, obviously. The NHS isn't always strong on these areas, although interestingly, the majority of the people on the webinar this afternoon come from the NHS, with about 67% NHS, 30 odd percent council, 30 odd percent third sector. I don't like putting people in boxes, but we've done it anyway. What do you think of this could be done kind of more in the kind of the ambulance sector in your experience, appreciating you just started a new role?
Yes, I have. No, great question. And I am day 6, and I've been thinking about this since day 1. There is an ambition within the organisation from what I've read from their organisational strategy to move more towards population health and really addressing health inequalities, which is excellent for an ambulance service, not traditionally typically in this space to aspire to. At the moment, I think from my perception, it's very high level. It's an aspiration, so it certainly needs to be worked through and developed. And I would, I'm not sure if that would fall under my remit at the moment, but I would love to be involved in using the research that I've developed to help shape that agenda going forward. But it's very reassuring to see that is their ambition as well, to have that more integrated care, and respond to what we know is a national priority.
Thank you, Helen. That's great. So the first question comes in from Carol. She says, I've noted there is a really low number of public attending wellbeing events. How can we turn this around to achieve maximum participation?
That's a really, really great question. It's going to come down to funding, isn't it? I think that was what I found hearing from the participants that I spoke to. It's funding enables that for the events to take place, the marketing, the advertising, paying for people's time and input that they provide into any sorts of forums where you do seek out community engagement. I don't know what the answer is. It's very tricky. I think there's only so much you can do on volunteers and goodwill, and I think it's building your networks will certainly help, I think, and hopefully the spread of good good development and practice will certainly help with that. But yeah, I'm not sure that there is an answer to that I can provide, but I will give it some thought.
It's tricky, isn't it? I appreciate the research you did. I think professionals can sometimes be quick to kind of see the benefits of this, although the interest in that is variable. I've heard a lot of colleagues over the years saying, we've tried to engage people, they just don't come. And it is hard. And I suppose the impact of engagement varies too, based on context. But I suppose people sometimes, I think you kind of touched on this in your presentation, didn't you? People feel they've engaged before and they're not sure what that led to. So their trust has gradually receded or maybe never was there to begin with. And I guess there's that kind of chicken or egg, do we need the public involved first? Do we need the community involved first? And that's maybe where the power is to kind of drive this in a direction, or do we need to get the professionals together to create the open doors for us to work in that new way? It's complex, isn't it?
It is really complex, and I think there's probably no wrong or right answer, and maybe a little bit of both. I think what I did find was when it was done maybe on a very small scale initially, and if it was done right, then it was more powerful than that engagement that was a little bit more tokenistic and a bit more of a, it was, and it came across and it was perceived to be that tick box exercise really led by professionals. We actually know what we're going to do and we're just hoping you'll verify it. So early engagement is always going to be preferable. It's never going to be easy. It will take time. It will cost more money, more energy, more resource. But it is, as we know, it is the right thing to do. But there's got to be that level of strategic drive and organizational buy-in as well for that to happen. So happy medium of both, I would say.
Thank you. Keep the questions coming in. Thank you, Carol. We'll come to your second question in a second. If colleagues haven't managed to figure out how to ask a question, I appreciate it comes up differently on the host, but it should be somewhere on your Q&A section. Feel free to add in a comment, reflection, or a question because we've got a few minutes left. The next comment, Helen, came in from Chloe Keel. So Chloe is a community involvement officer with the Integrated Wellbeing Network program. So Chloe, you've got a name drop in here. I know her colleague, student development lead for the IWN program in Newport, Victoria, I believe, is on the webinar too. Chloe's actually given some positive feedback of the Welsh Ambulance Trust, which you might be pleased to hear about in your new role, Helen. Chloe said they've had great links with the Welsh Ambulance, regular attendance at their place-based clubs in Newport. So there's some early positive glimmers, I guess, really, that some of this collaborative integrated working in a place-based way is happening in some parts, really. So that might be an opportunity to follow up afterwards. We've got a question from Carol, Helen. There is a gap in the knowledge of community resources with clinical and medical staff. Any ideas how we might approach this?
Oh my goodness. I don't know. That is really tricky, isn't it? I think are these clinical staff based in large health boards? Are they what's the
Carol asks good questions, doesn't
she
don't
does
they?
ask very good questions.
So I suppose this possibly is down to the kind of challenges for frontline clinical staff keeping up to date with all the kind of plethora of things going on in an area, but also kind of services to support people too in a kind of more holistic and social way. And I don't know if your research touched on some of the approaches that have been used to tackle this in Wales with Dawis, I believe, was a directory before, which I know possibly some colleagues have had, positive experience of working with, and some others. Was there anything in the research that would speak to how can we bind things together to make sure that people are working in this way kind of know to signpost or refer or engage people to other kind of place-based activities in the area around
So
them?
my research didn't touch upon this at all, actually. It was out of the scope of my research. But from my planning hat on now, I would say your planning team, your strategic planning team would be the place to go to have that access to that, or your comms team should be quite linked into that as well. And I think it's about exploring those different communication mechanisms that your health board or wherever those clinical leaders are based, and what forums they'd be linked into. Because every health board will be different, and they would have different tools and techniques and how they reach their clinical leaders. But I would signpost you to the planning team, that they should be the hub of the health boards or the trusts of where that intel and knowledge is, and they should be to signpost you in the right direction.
Thank you. Always, from my experience, been very critical allies, I think, really, in making things work and making things happen. Well, Ellen, colleagues, I think we'll start to wrap up there, if that's okay. I'd just like to express a huge thanks, appreciate it in amidst a shift of new role and lots of change happening. Helen, you've very kindly given us the time this lunchtime to talk to us about your experience and the research that you've led on place-based approaches. If people want to listen back to this afterwards, as we mentioned, it will be edited and published on YouTube shortly, with the opportunity for you to share that with colleagues and friends. Please do share this in your team, share this in your service, because the more people start to kind of see and hear some of this, the better. We are starting to try a kind of movement for change within the public sector, and we recognise that it's hard. So thank you for everyone else's time you've given of your lunchtime today. Just a few updates from 19 Hills Kick. So we do have a podcast alongside this, the 19 Hills Community Health and Capital podcast. Recently had a podcast with Dr. Lisa, a lifestyle medicine GP and specialist from Newport, which you can download and listen to on Spotify, Apple Podcasts, and possibly some other platforms too. We've got further opportunities for webinars. If anybody's got any interesting topics, any interesting speakers, please do drop us a line at info@19hills.org. And if you do happen to be joining this from Newport or anywhere near Ringland and Alway, which is where we're obviously largely supporting, we do have a community walk with some colleagues in the Friendship Foundation, a new kind of sports interested community Connection, not for profit. That will be on Sunday, the 26th of October, lunchtime start at the Labour Club. Details should be going out of our social media website soon. Thank you again, Helen. I hope you've got something out from today. If you could share with us the report, that'd be absolutely fantastic. It's great to see in the chat some links already forming from this, and great to see again such great attendance. Thank you, Chloe. We'll make sure we get your contact details shared to people on the webinar and also with Helen. And until next time, thank you, Helen. Thank you, everybody, and enjoy the rest of your day.
Thanks. Bye, Johnny. Bye.